Here is the scan of the room, one wall, the patient, the surface with my tools, the other wall, and the ceiling. Okay. I am Courtney Millington. It is November 7th, 2021. I am completing my head-to-toe assessment for the University of Memphis FNP program, and this is my patient, Charles Millington. I'm first going to start by just assessing his skin. Color is consistent with ethnicity. Texture, temperature, it's warm, dry to touch. I see no swelling, no redness, no edema. I'm looking for bruises, scarring, lesions, symmetry, and any nevi. I'm then going to look at his head, his neck, his face, his anterior chest, posterior chest, and abdomen. I'm going to start by inspecting his head. It is midline position, normal cephalic, and symmetric. I'm then going to palpate his scalp. His hair color is brown. Its texture is coarse. His hair is evenly distributed. I feel no masses. Do you have any tenderness?
No.
I see no lesions, no infestations, no indentations. Okay. I am then going to palpate his temporal arteries as well as the lymph nodes. So pre-auricular, post-auricular, occipital, tonsillar, submandibular, submental, anterior clavicle, posterior clavicle, and supraclavicular. And then I'm going to assess cranial. Actually, I'm going to have him clench his jaw, assessing his TMJ and cranial nerve number 5. Trigeminal, I feel no subluxation. Did you have any tenderness?
No.
And no crepitus? I'm then going to also assess cranial nerve number 5 with light touch sensation. So close your eyes and just tell me where I touch.
Forehead, cheek, chin, nose.
Perfect. And cranial nerve number 7 for facial symmetry. So smile, frown, raise your eyebrows, puff out your cheeks, and pucker your lips. So cranial nerve number 7, facial symmetry intact. I'm then going to inspect the patient's ears. I'm looking for position. I'm looking for any discharge, palpating the pinna and the tragus. I feel no masses. Do you have any tenderness there?
No.
Perfect. Then going to inspect the auditory canal and the tympanic membrane bilaterally. And I see the auditory canals are without redness. I see no discharge. The tympanic membranes are present and pearly gray with the cone of light visual. I'm then going to assess cranial nerve number 8, first by performing the whisper test. So just close this ear, and when I whisper, let me know what you hear me say.
Apple.
And then close this ear, and when I whisper,
Bat.
good. I'm then going to perform the Weber test by striking this. I'm going to place it on your head. Let me know if you hear it equal bilaterally or if you hear it on one side versus the other more.
Equal.
Perfect. I'm then going to perform the Rhine test by hitting this again. I'm going to place it on your mastoid bone and then by your ear and let me know when you hear it stop at each position.
No. 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 No.
Perfect. Air conduction is greater than bone conduction. I am then Moving on to the patient's eyes, I'm looking at his eyebrows. His eyelashes are pointing away from his eyes, as well as his cerebral fissures. I'm going to look at his conjunctiva, which are pink and moist, and his sclera, which are white. His eyes are blue, and I see no lesions or discharge from there. I am then going to test cranial nerve number 2, which is gross visual acuity, as well as peripheral and central vision. So I'm going to take the Snellen chart and stand 6 feet away. So if you could please cover your right eye, and I'm just going to let you read the smallest line you can to me.
LTFPH.
Perfect. And then close your other eye and read the smallest line you can see.
LTFPH.
Perfect. So 20/20 vision in both left and right eye. And then to test peripheral and central vision, just let me know when you no longer see my fingers.
So, no.
Perfect. And then I'm going to assess cranial nerve number 3, ocular motor, which is direct and consensual pupillary reaction to light. And I'm also assessing for the red reflex, as well as other internal eye structures. And then to test cranial nerve 3, 4, and 6, ocular motor, trochlear, and abducens with EOM. So just follow my finger, but keep your head straight. Perfect. And then accommodation and convergence, just follow my finger into your nose. Great. I'm then going to inspect the nose. The nose is midline and straight. I'm going to get you to close your eyes and tell me what you smell.
Coffee.
Cranial nerve number 1, olfactory, sense of smell, and tact. And then for nasal patency, just close each nostril and take a breath. Perfect. Nares are patent. And then I'm going to palpate the frontal and maxillary sinuses. Do you have any tenderness?
No.
Good. Okay, I'm then moving to the mouth, and I am just going to look at first his lips, and then if you could just open your mouth, keep your tongue in. I'm looking at his teeth, his gums, his buccal mucosa, his posterior pharynx, his palates underneath your tongue. Perfect, you can put it down. And salivary glands. If he had tonsils, I would grade those. I'm then going to have you say ah and stick out your tongue. And cranial nerve 9 and 10, which is glossopharyngeal and vagus are intact as the soft palate and uvula rises symmetrically with phonation. Stick out your tongue. Cranial nerve number 12 intact as his tongue is midline without fasciculations. I am then going to palpate his trachea, which is midline, and the thyroid gland. Just swallow. Perfect. And then palpating the carotid pulses for pulsation bilaterally, one at a time. And then I'm going to listen with the bell of my stethoscope for any bruise. Perfect. I'm then going to have the patient turn. And now I'm inspecting the posterior chest, looking for any respiratory distress. I don't see any use of accessory muscles, no nasal flaring, no tripod positioning, no retractions, no cyanosis, no tachypnea. I'm then just going to have you breathe in and out. For chest expansion is symmetric. I'm going to test for tactile dermatitis. So every time you feel my hand, just say 99.
99, 99, 99, 99, 99, 99.
Very good. And I'm now going to percuss in the intercostal spaces. Great. And I'm going to Now auscultate. Just take a deep breath when you feel my stethoscope. Making sure I get the lateral lung fields. Perfect. And now I'm going to test for egophony by having the patient say E every time you feel my stethoscope.
E, 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 E.
And bronchophony by having the patient say 99.
99, 99, 99, 99, 99, 99.
Perfect. As whisper paractally, just whisper 1, 2, 3.
1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3.
Great. I hear all breath sounds are clear with no adventitious breath sounds present. And I'm going to get you to now turn. And I'm now looking at the anterior chest, and I see no deformities. It's symmetric. The posterior chest, I also saw no deformities, and it was symmetric. Also see no signs of respiratory distress. Testing for breathe in and out. Chest expansion is symmetric. I'm going to test for tactile fromatitis. Just say 99.
99, 99, 99, 99, 99, 99, 99, 99.
Perfect. As well as auscultating. Very good. I'm then going to listen to the heart with both my bell and diaphragm. So just aortic, pulmonic, Erb's point, tricuspid and mitral, aortic, pulmonic, Erb's point, tricuspid, and mitral. I'm then going to palpate and find the PMI and listen for 1 full minute at the apex for the rate and rhythm. Perfect. I'm then going to have you lay down on the couch with your head at a 30 to 45 degree angle. Good. And I am assessing JVD for any distension, pulsation, no heaves or lifts present. I'm going to palpate the aortic, pulmonic, Erb's point, tricuspid, and mitral, as well as auscultate again with both my diaphragm and bell in the aortic, pulmonic, Erb's point, tricuspid, and mitral, aortic, pulmonic, Erb's point, tricuspid, and mitral. And then moving to his abdomen, which is contour and symmetric. I am first going to listen to the aortic, renal, iliac, and femoral arteries. Perfect. I'm going to auscultate in all 4 quadrants of the abdomen. And vowel sounds are all normoactive. I'm going to then percuss for any tympany, dullness, or flatness. And I'm going to palpate for any tenderness or masses. Just let me know if you have any tenderness. Perfect. I'm then going to have you sit up and just kind of keep to the side a little and test for CVA tenderness. Just let me know if you have any tenderness. Any tenderness there?
No.
Perfect. Okay, so now standing this way. Okay, now I am moving to musculoskeletal, and I am first just inspecting everything, looking over the skin. I'm looking for crepitus, symmetry, any nodules, swelling, redness, edema. Skin is warm and dry to the touch. I'm going to test his capillary refills and his radial pulses. I'm going to assess grip strength, if you could just grab my fingers. Then palpating the joints of the hands, the wrist, the elbows, and the shoulders. Do you have any tenderness?
No.
Perfect. I'm then going to do range of motion of your fingers. So we're going to start with flexion, extension, abduction out, adduction in, and then your wrist. So flexion, extension, radial and ulnar deviation, and then rotation, and then your elbows, range of motion. So flexion and extension with no hyperextension there. Range of motion of your shoulders. So we're going to do adduction in, abduction out, flexion up, extension back, internal rotation, and external rotation. Perfect. And then I'm going to test the strength of your shoulders. So just shrug against resistance. And cranial nerve number 11, accessory, as we do abduction out while I push in, adduction in as I push in. Perfect, and that's 5 out of 5 strength there. And then to test the strength of the biceps and triceps, so hold your arms out and just push up while I do down, and then go like this, and push out, and then in. Perfect. 5 out of 5 strength, symmetrically in all upper extremities. I'm then moving to his lower extremities. Again, just looking for edema, redness, crepitus, swelling, nodules, symmetry, testing the capillary refill in the toes, and his pulses, and the dorsalis pedis. Perfect, and then the joints and the feet and the knees and your hips. Do you have any tenderness anywhere? And then I'm going to do range of motion on your toes. So that's going to be flexion down, extension, abduction out, adduction in. And then we're going to do range of motion of your ankle. So flexion, extension, and then eversion and inversion and rotation. Perfect. I'm going to test the strength of your hips. So abduction, pushing my hands out, adduction, pushing my hands in, and then of your knees, so flexing them out while I push against you. Good, and then bringing them in. Great. And then of your ankles, if you could just push down. Good, and then push up. Perfect. 5 out of 5 strength, equal bilaterally on all of the lower extremities. I'm going to do light touch sensation on all of the extremities, so just close your eyes and let me know when I touch.
Now, 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 now.
Very good. And then the deep tendon reflexes, so brachioradialis, his bicep, and then triceps, and then patellar, and then Achilles, and then I'm going to test the Babinski, Perfect. And then I'm gonna have you cerebral function. I'm gonna have you do finger to finger, as well as hand wrist flop. Perfect. And then I'm gonna have you stand up, and I'm gonna assess range of motion of your hip. So we're gonna do flexion, extension, and then we're gonna do external rotation, internal rotation, and then we're gonna do abduction out both sides and abduction in both sides. Perfect. And then as we test range of motion over your knees, so flexion and extension, flexion and extension. Great. And I'm gonna have you turn and bend over, and I'm looking at his spine. Do you have any tenderness?
No.
Normal curvature, no scoliosis present. You can stand back up. I'm going to assess range of motion of your spine. So we're going to flex, extend, lateral, and then rotation. And then your cervical spine, so flexion, extension, lateral side to side, and rotation. And then I'm gonna have you close your eyes and your hands beside each other for the Romberg test. I'm gonna have you walk that way towards the video, open your eyes and walk that way to assess his gait, and then walk back towards me. Perfect. And then the tandem walk, which is gonna be toe to toe, heel to toe, and then walk backwards that way. Perfect. And then open your eyes and hop on one foot. And that completes my head to toe assessment. Thank you.